My name is Brooklyn Williams, and this is my presentation for the critical assignment. The critical assignment is on the past, present, and future of public health. Question number 1. What is public health? What is health? A state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Definition of public health. My definition. I would define public health as preventing sickness/illness, steps to prolonging life, promoting health, and doing all of this with the effort of society. Public health looks at how and why something is happening to prevent it from happening in the future. It is different from clinical medicine because clinical medicine is for fixing the immediate issue, the individual, and ultimately present time. The actual definition of public health is the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community effort for the sanitation of the environment, the control of communicable infections, the education of the individual in personal hygiene, the organization of medical and nursing services for the early diagnosis and preventive treatment of disease, and for the development of social machinery to ensure everyone a standard of living etiquette for the maintenance of health, so organizing these benefits as to enable every person to realize his birthright of health and longevity. This is a picture of words that have to do with public health, such as bills, treatment, public, doctor, vaccine, quality of life, disease, healthcare, and so much more. This shows that public health is so much more than we think it is and has many different layers. Philosophy of public health. My idea. I think the philosophy of public health is to research, prevent, prolong, and look at society. When I think about public health, I think their job is to look at the bigger picture rather than what is just in front of you. Actual philosophy. The philosophy of public health incorporates the values and traditions of communities and of relevant professions, providing an intellectual foundation for organized action to reduce suffering and promote well-being. Core values of public health. Some of the core values are systemic inequities, population-based approach, upstream focus. Systemic inequities look at where people are born, work, and live. This is because these things determine people's access to resources such as safe drinking water and reliable health care. Population-based approach looks at the society as a whole and informs educators, policymakers, and community leaders. Upstream focus is looking at potential health issues and working to prevent them. They want to help prevent harm, improve health, focus on the community, and be beneficial for others in need. Each of these is important, and public health needs all of them. Question number 2. Identify and describe several common social determinants of health, including how they influence health outcomes. What are social determinants of health? Social determinants of health are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. As defined by the World Health Organization, these forces, examples, racism, climate, and systems include economic policies and systems, development agendas, social norms, social policies, and political systems. Social determinants of health include economic stability, neighborhood and physical environment, education, food, community and social context, healthcare system. On the right, there are pictures, and these show what each social determinant of health looks like as a picture. Factors of economic stability include employment, income, expenses, debt, medical bills, support. Economic stability means that people have the resources essential to a healthy life. Factors of economic stability are important for numerous reasons. Money is a huge part of people's day-to-day life and can affect all areas of their life. The more money people have, the better insurance, house, food, medicine, etc. they can buy. Having more money ensures that they can get all the help they need to make life better and ultimately live a healthier life. People who don't have much money struggle because they are worrying about bills, medicine they can afford, and so much more. This can cause stress, deter them from getting the help they need, etc. Factors of neighborhood and physical environment include housing, transportation, safety, parks, playgrounds, walkability, zip code, geography. Where we live is very important in public health. There are places that are high and low income, safe and dangerous, clean and dirty, accessible and inaccessible. The places that people live in affects their health, and that is why public health pays attention to it. Factors of education include literacy, language, early childhood education, vocational training, higher education. Factors of food include hunger, access to healthy options. Food is a necessity for every living thing, humans included. Without food, we will die, but we also need to focus on what food we are putting in our bodies. There is also hunger. There are many people out there who struggle to have enough food to eat. This is because of their lack of money. It is horrific that some people go days without food because they can't afford to feed themselves or their family. This can also lead to health issues in the future or during the time that they're eating unhealthy food or not eating at all. Factors of community and social context include social integration, support systems, community engagement, discrimination, stress. Factors of healthcare system include health coverage, provider availability, provider linguistic and cultural competency, quality of care. Health outcomes include mortality, morbidity, life expectancy, healthcare expenditures, health status, and functional limitations. On the right are pictures to show what some of these mean. How social determinants influence health outcomes. Research shows that social determinants can be more important than healthcare or lifestyle choices in influencing health. For example, numerous studies suggest that SDH account for between 30 to 55% of health outcomes. In addition, estimates show that the contribution of sectors outside health to population health outcomes exceeds the contribution from the health sector. Addressing SDH appropriately is fundamental for improving health and reducing long-standing inequities in health, which requires action by all sectors in civil society. Part 2. Each person's life is unique, and this goes for all their social determinants as well. These social determinants are crucial in the health and life. It is crucial to look at each one of these areas when a person is sick or even to prevent illnesses in the future. Possible outcomes for behavior is tobacco and alcohol use, nutrition, physical activity, and sexual activity. Possible outcomes for disease are chronic disease, infectious disease, and injuries. Possible outcomes for mortality are infant mortality, maternal mortality, and premature deaths. Question number 3. Describe what is meant by health equity and why it is essential for positive health outcomes. How does it relate to a Christian perspective? What is health equity and inequity? Defined as individuals having a fair opportunity to attain to their full potential. Thus, health inequity occurs when societies as a whole, not just their public health or health systems, fail to provide the social, economic, and the other conditions for their residents to have such fair opportunities. Example. In this picture are examples of equality and equity. In the equality picture, every person is given the same number of boxes, even if it may not work for everyone. In the picture of equity, each person is given different amounts of boxes that will efficiently help the individuals. Equity is to give everyone equal opportunity instead of giving them equal resources, as in this picture. Inequity is lack of fairness and justice. Christian perspective. In my opinion, health equity relates to Christianity because of the equal opportunity they present. Christians believe that God loves each and every person equally and gives them the chance to spend eternal life in heaven. People do not deserve this grace, but God gives it anyways. He gives every person this opportunity no matter what their background is or any other reason. Health equity is taking away all of the injustice and unfairness, resulting in the same opportunity for everyone. In both situations, it is equal opportunity, not condemning someone because of their background, and providing a bright future. Question number 4. Describe the roles of governmental and non-governmental institutions in shaping population health outcomes. Governmental organizations. Department of Health and Human Services includes CDC and 7 other public health service agencies. Other federal agencies, including Department of Agriculture and Environmental Protection Agency, also impact health. Spending on health represents more than 1/4 of total federal budget, although 90% is for personal health care services via Medicare and Medicaid, health care rather than public health. Funding for the CDC has declined over 10% since 2010. The Affordable Health Care established a new source of funding for public health known as the Prevention and Public Health Fund, but funds have been used to supplant rather than increase available resources. Federal level. Provides general welfare and regulate commerce. Earliest federal health unit was the Marine Hospital Service, established in 1798. Over time, it evolved into the U.S. Public Health Service. The 16th Amendment provided the federal government the authority to raise financial resources through a federal tax income. This made it possible to address health problems, needs, and transfer resources into both the state and local governments. After 1965, the federal government emerged as a major purchaser of health through Medicare and Medicaid programs. Continued. The most known public health agency at the federal level is known as the CDC. It was established in 1948. Its original focus was communicable diseases and addressed polio and smallpox. It expanded focus to non-communicable diseases, formed a division for chronic diseases in 1975 and an anti-smoking program in 1976. Today, the CDC and federal agencies such as Health Services Resource Administration and the National Institute of Health continue to influence state and local public health practice through the scientific expertise, technical assistance, and funding they provide. At the state level, states developed structures and organizations needed to use their police powers to protect citizens from communicable diseases and environmental hazards, primarily sewage, water, and food. First developed in Massachusetts in the late 19th century, states sought out federal funding when federal grants became available. The funding was for maternal and child health services, public health laboratories, and other basic public health programs. States often surrendered some of their autonomy over health issues because they would accept grants that were tied to specific programs and services. The federal government dictated its own priorities to states during these times. This meant that states could not choose exactly what they were focusing on, but they had to focus on what they were funded for with the grants. Local level. Counties became the primary local government jurisdictions with the health roles after 1900. States give local governments specific responsibilities, and additional authorities are allowed through Home Rule. Home Rule permits local jurisdictions to enact local constitution or charter and to take an additional authority and powers, such as the ability to levy taxes for local public health services and activities. The first county health department was established in 1911. Big city health agencies are an important force in the United States public health system, enticed by the availability of federal funding and preferred to take their higher level rather than making their own revenue to finance services. All levels. Each level is like a layer. They all have their own roles and what makes them important. They all need each other to work and divide the roles. To me, the governmental levels are the most complicated part of public health. They deal with funding, the CDC, agencies, welfare, and commerce, and so much more. The federal level is the top level, and the state level is under that. The local level takes on the responsibilities the state levels give them. Without these levels, public health would not work. Everything I have listed in the past few slides is essential to public health. Non-governmental organizations. Communities, the healthcare delivery system, employers and business, the media and academia play important roles in public health system. An increased recognition of the impact of the social determinants of health has encouraged states and localities to implement a health in all policies approach to policymaking. Health in all policies identifies ways in which policy decisions in multiple sectors can improve health while also achieving other goals such as promoting job stability, improving neighborhood safety, increased transportation options, etc. Non-governmental partners play an essential role in the success of the public health system. Employers and businesses contribute to the health of the population by providing income to community residents, controlling workplace conditions that support or impede health behaviors, and determining health insurance benefits for employees. Significant actors include the media, communities, and academia. Media is important because it provides messages that supports healthy behavior. Communities, including schools, churches, voluntary and civic organizations, residents themselves, are also central because they can organize support for public health action and because they too influence health behaviors. Academia is vital because colleges and universities can support governmental public health agencies. They can do this by helping to conduct research and analyze public health data. They also have the role of training the future public health workforce. Non-health related governmental agencies. Non-health related governmental agencies are important because of the factors of health outside the direct control of the public health or healthcare system. These factors include housing, income, neighborhood safety, and quality of schools. Practically, the factors are wrap-up of non-governmental and non-health related agencies. From what I've learned, they work to improve our way of life in their own way, such as helping where we live, safety, transportation, job stability, and so much more. They also focus on where we work and how to improve the situations to improve the health of citizens. From what I gathered, they all just want to focus on improving our quality of life to improve our health. Our quality of life and health go hand in hand, and I am glad public health focuses on that. Question number 5. Discuss the 3 core public health functions and how they relate to essential public health services. 3 core public health functions. The 3 core public health functions would be protection, promotion, and prevention. Protection is about protecting the health of the populations. This includes the control of infectious diseases, environmental hazards, healthy workplace, and managing health emergencies. Promotion is about improving the health of the population. This includes focusing on the individual, promoting health behaviors, improving the social determinants of health. Prevention is about preventing health issues before they occur. This includes vaccinations and screenings. This is a picture to hopefully help you understand. Promote. Working with communities and engaging with individuals to promote health. Prevent. Ensuring healthy development, enabling healthy behaviors, living and working in healthy environments. Protect. Addressing threats to health, responding to outbreaks. Question number 6. Briefly describe the history of public health, including key events and accomplishments from antiquity through today. Achievements and milestones in history. Federalism, state, and local health units were put into place. They all play their vital individual role in the public health and healthcare system. The Prevention and Public Health Fund was established by the ACA. The PPHF was to provide a stable and increased investment in activities that enable communities to stay healthy. The health system is focusing on more than just health. This is HIPAP, and they focus on housing, income, neighborhood safety, and quality of schools. Environmental health. The number of environmental health activities directly performed by state health agencies has decreased between 2010 and 2016. Key federal environmental statutes include the Clean Air Act and Safe Drinking Water Act. Despite their diminished role in environmental concerns, state health agencies still are the home to traditional public health activities related to environmental health, such as disease surveillance, epidemiologic investigations, health risk assessment, and communication, toxicology, laboratory services, and sanitation programs such as restaurant inspections and public drinking water systems. Health departments play an important role in lead poisoning prevention and control as well. In the CDC 2019 enacted budget by key program areas, environmental health had $2,009 and $305,000. One division of ATSDR is the Division of Environmental Health. ATSDR stands for Toxic Substances and Disease Registry. It protects communities from harmful health effects related to natural and man-made hazardous substances. It is also closely associated administratively with the CDC. Roles of vaccines and their impact on infectious diseases. Section 317 Immunization Program. The Section 317 program provides grants to state, local, and territorial health agencies to purchase vaccine for uninsured adults and outbreak response, to enroll, educate, and provide vaccine to over 40,000 private physicians in the Vaccines for Children program, immunizing millions of children annually, to track vaccination rates and vaccine inventory, and to identify disease and incidence and stop transmission of deadly, preventable, and disease. Funding in the FY19 enacted budget was $610 million. Vaccine management is one of the primary prevention activities. Continued. There are many vaccines out there, such as ones for chickenpox, influenza, hepatitis A and B, HPV, and so many more. The most recent one is the COVID-19 vaccine. This vaccine was made fairly quickly because of the present and horrible coronavirus. So many people died, got sick, had to quarantine, and everyone's lives were affected. COVID-19 was all around the globe. In 2020, people saw a virus take over our world, and to me, it was our first encounter with something like plagues we see in our history books. Now with the vaccine, people are able to get back to their lives, go back to work and school, and essentially live again. Tobacco control. The Supreme Court ruled that the Food and Drug Administration, FDA, overstepped its authority when, in 1996, it defined nicotine as a drug in order to regulate tobacco products. Over 10 years later, Congress passed a law specifically granting this authority to FDA. FDA protects the public from electronic product radiation and regulates tobacco products. Primary prevention activities include population-based prevention focused on tobacco prevention, one of the top priorities for state agencies in tobacco prevention and control. A total of 25% of state health agency funds come from the state general funds, which are funds received from general revenue to fund state operations, 11% from other state funds, 10% from other resources, including payment for direct clinical services and tobacco settlement funds, and 6% from fees and fines. Bible times. In the Bible, you read a lot about famine, diseases, rough lives, etc. While reading the Bible, taking religious classes, and going to church, I have read and heard many things that I can relate to healthcare and public health. I have heard about leprosy, unclean and clean food, sexual relationships outside of marriage, and the biggest disease of all, sin. The first 5 books of the Bible, the Pentateuch, provide tremendous insight and relief concerning disease prevention. Remarkably, the Pentateuch is regarded as the earliest evidence we have of sound public health and sanitary practices. In Leviticus 15, it talks about how to handle someone who is unclean. If someone touched the unclean person, they were too considered unclean. They would need to wash their hands before and after touching someone or something that was unclean. This relates to now because just a little more than 100 years ago, these precautions were instituted in modern medical facilities to prevent diseases from spreading. No-touch surgical dressing techniques are now used. Gloves are necessary for persons touching infected areas, and careful hand washing is observed before and after patient care. Things that were touched by someone unclean had to be washed or destroyed. People's garments needed to be washed several times or burned, while objects such as pottery needed to be destroyed. This was during biblical times. This relates to now because hospitals use disposable equipment that is only used once, such as syringes, needles, eating utensils, dishes, etc. All of these items are disposed of after use. Things like clothing, bedding are washed or burned depending on what type of disease, illness, infection touched it. With things like leprosy, the person was to be isolated and wearing a covering over their mouth. To me, this seems exactly like what happened with the coronavirus. In general, there was a countrywide quarantine time when the virus was spreading crazily. If someone was infected with COVID, then they would have to quarantine for 2 weeks. People who were exposed also had to quarantine, and everyone needed to wear masks. Biblical times may be very far in the past, but they focused on health as well as us. They did some of the same things that we still do today. Sanitation is immensely important during that time, and we will talk about sanitation more on the next slide. Florence Nightingale. Florence Nightingale was the founder of modern nursing. She was from Florence, Italy, and was born on May 12, 1820. She lived in an upper-class household. Instead of doing what she was expected of her, she went to study at Kaiserswerth Hospital and took a job at a hospital in London, later becoming the head of nursing in only a year. She thought sanitation was immensely important. She was reached out to during the Crimean War. The conditions of the injured were horrible. They were lying in their own filth, and more were dying from infections from their own wounds. Florence Nightingale made sure there was fresh air, water, healthy food, and that bedding and bandages were cleaned adequately. She ended up reducing the death rate of these military hospitals by 2/3. To me, that is incredible, but also sad that so many people's lives beforehand could have been saved if others realized how important sanitation was. She founded the Nightingale Training School for Nurses in 1860. She was a huge part of what nursing is today and made a great change during her time. This is my timeline. In 1500 BC, the book of Leviticus is believed to be the first written health code in the world. It talks about cleanliness, sexual health, protection against contagious diseases, and the isolation of lepers. In 500 BC through 500 AD, Hippocrates was the founder of Western medicine. Romans also improved aqueducts to protect water supplies, and they created the first hospital. In 1350, the Black Plague reappeared in Europe in 1348. This was nearly after 1,000-year absence. 1860, Florence Nightingale opened a training school for nurses. She completely changed people's view on nursing. In 1948, the World Health Organization was established by the United Nations. In the 1950s, the first effective polio vaccine was developed by Jonas Salk. Through mass immunization, the disease was wiped out in America. In 1960, Searle receives FDA approval to sell Envoid as a birth control pill. Searle was the first and only pharmaceutical company to sell an oral contraceptive. In 2000, Healthy People 2010 was created. This would be the blueprint for the public health infrastructure in the new century. In 2020 through 2022, COVID-19 spread across the globe, infecting and killing millions. During this time, the vaccine was created and released. Significant events. In 1789, the earliest federal health unit, the Marine Hospital Service, was established. In 1911, the first county health department was established. In 1965, the federal government emerged as a major purchaser of health care through Medicare and Medicaid programs. In 2008 through 2015, total state health agency revenue has fluctuated over time from $29.1 billion in 2008 to $28.6 billion in 2015. In 2016, the occupational classifications with the greatest number of employees at state health agencies were office and administrative support, businesses and financial operations, and behavioral health staff, followed by public health nurses. Question number 7. Identify and describe at least one current issue, challenge, and/or limitation facing public health and its practitioners today, and how we overcome it. Climate change. Climate change has been described as a public health emergency with adverse health impacts already being felt and expected to increase in the future. Changes on health include direct effects of heat stress, increased extreme weather events such as hurricanes, degradation of air and water quality, threats to the food supply, changes in the distribution and ecology of disease vectors such as mosquitoes and ticks, social and mental health impacts of societal disruption. Public health practitioners must be prepared to address the different impacts of climate. Increased extreme weather events causes injuries, deaths, poor mental health, disruption of healthcare systems. Increased heat causes heat-related illness and death. Poor air quality causes increased asthma, COPD, and other respiratory diseases, increased cardiovascular disease. Poor water quality causes increased waterborne diseases and dehydration. Threatened food supply causes increased foodborne diseases and malnutrition. Changes in disease vector distribution causes increased mosquito-borne and other vector-borne diseases. The impact on society will be poor mental health, social disruption, forced migration. Overcoming climate change would be to monitor health status to identify and solve community health problems, diagnose and investigate health problems and health hazards in the community, inform and educate, empower people about health issues, mobilize community partnerships and action to identify and solve health problems, develop policies and plans that support individual and community health efforts, enforce laws and regulations that protect health and ensure safety, link people to needed personal health services and ensure the provision of health care when otherwise unavailable, ensure competent public and personal health care workforce, evaluate effectiveness and accessibility and quality of personal and population-based services, and number 10, research for new insights and innovative solutions to health problems. Public health practitioners will need to become involved to push HVAP approach to climate change and reduce carbon emissions at the local, state, and national levels. There will also needs to be no production that can be broken down, less fast production, recycling, pollution prevention, etc. Poor mental health, suicide, and alcohol abuse. There has been an increase in alcohol and suicide-related premature deaths. This has been particularly noted in white populations outside major urban areas. These deaths stem from, but aren't limited to, the following: poor mental health, lack of access to mental health treatment, underlying social and economic stresses that impact many communities. It is estimated that at least 44.7 million Americans experienced a mental health problem in 2016, a number that is likely an underestimate due to the stigma that mental illness carries. Between 2000 and 2015, suicides increased 28% to more than 44,000 deaths a year. Alcohol is involved in up to a quarter of suicides. Adverse childhood experiences are linked to a wide variety of poor health outcomes in adulthood. These include physiological and sexual abuse, household dysfunction such as family member with substance abuse, mental illnesses, and criminal behavior, violent events such as suicide of a family member or a mother subjected to domestic violences, common with 10 to 25% of people reporting such experiences in childhood. The risks are obesity, smoking, heavy alcohol abuse, mental illness, problematic drug use, interpersonal or self-directed violence. They are all a huge thing in the world, whether people admit it or not. Mental illness is prevalent, but not talked about enough. People with mental illnesses are scared to get the help that they need because there is such a negative stigma around mental illnesses. This negatively affects them because they can't improve if they won't seek help. Suicide is a tragic thing, but happens more than we know. People feel as if there is nothing left to live for and they end their own lives. This is horrible because people's lives should be worth more and no one should feel as if their life is so terrible that they would rather be dead. Alcohol abuse is a very big thing in our world as well. People will drown themselves in alcohol to feel better about the world. Eventually, it turns into an addiction and they need alcohol to survive. People with alcohol abuse will drink from the point they wake up until the point they fall asleep. It is detrimental to their bodies, minds, and lives. Overcoming these things would include increased surveillance efforts to measure the magnitude and trends in the problems, enhanced surveillance in each state for violent deaths. Implementation of evidence-based community support and suicide prevention programs are also important. They can help people to optimally manage adverse events and traumas. Early identification of toxic stress situation and intervention is key. It can prevent or lessen the poor mental health outcomes. Multi-sectoral approaches are needed involving public health agencies, healthcare providers, schools, law enforcement, community-based organization, social services, and mental health and substance treatment agencies. Question number 8. Discuss the public health practitioner of the future and the skills needed to be effective. Core competencies for public health professionals: analytic assessment skills, policy development, program planning skills, communication skills, cultural competency skills, community dimensions of practice skills, public health sciences skills, financial planning and management skills, leaderships and systems thinking skills. Management science. This capability involves systems thinking based more formally on systems methods. These methods include social network analysis, system dynamics modeling, agent-based modeling. Communications capabilities. The world is changing, and one thing that is changing is the internet. The biggest thing in the world today is social media. This has to do with apps people use on a day-to-day basis, advertisements, and spreading information. Social media has its pros and cons, but what people do not think about is how it can affect public health practitioners. The sharing information will challenge public health to find the most effective ways to have its message heard through the cacophony of information that bombards people regularly, and to counter misinformation and anti-government, anti-science messages which are persuasive. In the 21st century, people hear a lot of things on the news, social media, through others. It is hard to know what is true and false, especially when it comes to health. One example would be COVID-19. During COVID, people were receiving all sorts of information, and the majority of the time the information was contradicting. Different news channels were saying different things about the virus. Each state had different rules and regulations for the virus. It was hard to know what the right thing to do was in this situation. This relates to the communications capabilities because if there is so much more information out there, then everyone is thinking different things. It is important that all healthcare practitioners and the world as a whole are relaying the same information to the public. This will help citizens themselves, but also the practitioners, because hopefully people will listen to what they are told and less people will get sick, as in the COVID-19 situation. Entrepreneurial orientation to their work. Principles they should be focusing on include proactiveness, innovativeness, risk-taking. Transformational ethics. While ethics with a focus on social justice have guided public health for a long time, public health practitioners need to be more intentional about incorporating ethical principles into priorities and programs. They need to recognize the potential adverse impact of public health policies and programs that do not aim for health equity as an end result. Policy analysis and response. Public health practitioners need to constantly surveil the rapidly changing environment. This would make it so new policies and policy changes happen in a timely way. The reason for this is because they were constantly surveilling the changing environment. Then the public health practitioners would be prepared and anticipate when the policies need to happen. Question number 9. Identify and discuss what you feel will be the most important public health achievement in the next 25 years. Biggest achievement. In my opinion, the biggest achievement would be safer and healthier foods. From what I know, the foods we eat on a day-to-day basis are not good for our bodies. People have to do a lot of research on the food they are buying and ingesting because companies put chemicals and all sorts of things in our food. When people travel to Europe, they talk about how they eat all the same food and that they come back to the United States but have different outcomes. I have heard that when people come home to the United States from those places, they feel bloated, sick, etc. The things in the food in the U.S. are slowly killing us, and it is unacceptable. It shouldn't be unhealthy to be eating healthy food. There needs to be new laws, regulations about what is in the food in America, needed to achieve healthier and safer food. Laws and regulations on what ingredients are going into our food. Less fast food, because almost all fast food places are fried and unhealthy. They could create healthier menus, but they need to get rid of all the things that are damaging our bodies. And applying a nutrition standards at hospitals, schools, and child care facilities. Other achievements. Earlier I talked about mental health as one of the struggles. I think improving the help people can get is one of the biggest achievements our world and public health departments can accomplish. People should be able to seek help, receive information, and get the help and treatment they need. I also believe climate change is a necessary achievement. Our world is going downhill because people are not taking care of our earth. If people do not work to improve our planet, then eventually there will be no hope of fixing it. To improve mental health and climate change, you need many things. For mental health, you need to change the stigma around mental illness so people will seek help. School and workplace programs, social support, more work funds being put into diagnosis and treatments. For climate change, you need to reuse, reduce, recycle, anticipate climate impacts and assessing vulnerabilities, project the disease burden, assess public health interventions, develop and implement a climate and health adaptation plan, evaluate impact, and improve quality of activities. My additional thoughts on public health and this class. During this class, I have learned a lot. It opened my eyes to what public health is when I had no idea public health even existed. Public health is essential in our world, and I'm glad I decided to take this class. My favorite things that I learned in this class are mental health, climate change, Florence Nightingale, and social determinants of health. But my least favorite things were the government, because it was the hardest part to understand. These are my references, and I hope that you enjoyed my presentation.